here so that we don't cut into the table. That's the only reason why we have that. Okay?
So you put this on
First.
before the patient lays down?
Correct.
Okay.
Okay. And then basically, we're going to want, depending on the size of the individual, this is going to need to go around them. So we put it like this, like this. Okay. So then we need to do the pelvic.
Okay.
And doing it, you're going to be the patient?
Yeah.
Yes.
Okay.
My back's kind of bothering me tonight, so I'm not going to do it.
I'm shoveling that snow.
Snow blower.
Oh.
But yeah, we both did our driveways at home before we
Yeah,
got
I
here.
shovel, so
I haven't gotten
I
that.
old fashioned, I'm like, I
I
better.
do too, yeah.
Or-
It's a good exercise. I like that. Okay. So then what you're going to do is you're going to lay down.
How tight do you want this?
Believe me, it's going to be tighter once you
Oh,
lay
really?
back. Yeah.
Okay.
And then you can go ahead and lay down and then just put your arms, so scoot yourself up. So this is going to need to go around your chest a little bit higher up. I'm going to grab a pillow. We typically use a pillow with a pillowcase and all that other fun stuff.
Under his head?
Okay, yep, I got one. We're good. Okay, like that. All right. So, actually, can you scoot up just about 6 more inches? There you go. Okay. So then the patient's you're gonna put your elbow through like this, like you're parachuting. The other side. Like that, okay. And then we strap him in. Okay. And then what I want to do, because I want to make sure I can get it tight enough, I'm gonna put this here.
Move them all the way over to that side and
Yeah,
pull.
and let me know if I'm hurting you, okay?
Okay, that's fine.
But especially with men, you need to have, well, not necessarily the thoracic one, but the pelvic one, you need to have pretty tight. Okay.
My battery's dying.
What was it?
And this is why you need to empty your bladder beforehand.
Gotcha. Duly noted.
Okay? So then, what we'd want to do is go ahead, if you can bring, there you go. Just like that. Now,
What about these straps
those
underneath?
straps are gonna go this way, but remember when Rosemary talked about how, depending on where you're trying to actually, what disc level you're trying to hit would determined by the angle of hips.
Okay.
Okay? So right now, if we took a goniometric measurement, he's probably sitting at, I'd say maybe 60. So if we wanted his hip range of motion, okay? Here we go. So if I use this, I don't know, did you guys learn goniometric measurements yet?
No, we didn't get in.
Okay. So this is my stationary arm, right here.
Mm-hmm.
And I use this as my movable arm here.
So you're right at the hip?
Yeah.
Okay.
And I think we've got, that's 10, 20, 30, 40, 50. Okay, so that's
Okay.
pretty close. So if I wanted.
And what is the range that we wanted in?
It depends on what level of the disc. Most of, like, it's like 90 and then coming down, and that'll be in your notes as to what
Okay.
It's
angle.
broken down. Now, on the
Okay.
lab test, will it say your patient has,
Yeah, I mean, basically,
Okay.
I don't know if they're gonna get
At whatever disc
as
or something like
specific,
that.
right.
okay,
So the thing that's a challenge right now is that if I try to lift, because I can make this higher, so it'll give you more hip flexion. If I try to do that right now with your legs on it, it's gonna be challenging for me. So what I'm gonna do is I'm gonna have you bring just one knee into your chest. Actually, I'll have this one.
Okay.
One knee into your chest, grab onto your hand there. Okay, I'm gonna then just lift up. Then we're gonna put your leg down, both of them. There you go. What I was trying to do is prevent you from actually hurting your back further.
oh,
Because if people don't have strong enough core and they try to lower both of their legs.
Oh, and make that adjustment on it
Right.
now?
Right. So what I'm doing is I'm making it taller. And it's much easier to make it shorter than it is to make it taller.
That makes sense.
Okay? So you probably feel like your knees are into your chest, but. There we go. And go ahead and back down. There you go.
This one's almost off the
Probably
table
pretty
over
close.
here.
Yeah. Oh, is he over too far? Okay, so now he's all strapped in. He's close to 90. If not, we could just raise it even higher.
Okay.
And then what you'll do is we need the little, can I have the T?
Oh, this.
Yep. So to loosen this up, you pull it this way and it just loosens, okay?
Oh,
So I do this.
that little slip knot there.
Yeah, slip knot thing, because most people, what they're doing is they're actually freaking and they're trying to yank it, and you just end up making it even more of a challenge. There you go. Okay, so now we need to give him his call bell. Okay, so here's your call bell. All right. So depending on what the pathology is will determine what you're actually using this for, okay? So first thing we're gonna do is turn on the power, and nothing's gonna happen, okay? If you go, I'm talking loud enough so that you can hear this. Are you
Okay.
listening, or should I?
Yeah, no, I'm
Okay,
listening.
okay. So if I put it to preset, that allows me to set up everything, including the weight,
Okay,
before anything starts actually engaging, okay? It's like predetermining a speed of something. So
Okay.
we want to be half your body weight, so what would be half your body weight?
Half my body weight would be about 100 pounds.
but we want to go no more than 75 in our class.
Is that what she said?
Yeah,
Okay.
Really?
yeah.
Okay.
So if you're over 150, we're maxing out at 75.
Okay. All right, so we need to make a determination if we want it to be intermittent or static. Intermittent means it pulls and relaxes, pulls and relaxes. Static is just one long pull.
Okay.
If we do progressive intermittent, what that'll do is depending on how many steps we set, it's going to break up this amount of poundage by 3, by 4, whatever. So this one, it would break it up into 4 steps.
Okay.
What's the advantage of that is that if it gradually takes out the slack as opposed to one pull, which may be more comfortable for the patients and also allows the belts to settle in,
Okay.
because some people are more challenging to set up than others.
Okay.
Okay? So I'm going to choose it to be progressive. It's going to be 3. Then I need to choose my on and off time, and it just depends on the pathology, okay? And that's in your notes.
Okay.
But just for,
So, yeah, we'll set the number of steps to be desired, set the hold time,
right,
set the rest time,
right?
set it back to progressive intermittent, because that's what we were doing.
Mm-hmm.
And then check the patient.
Right. Okay, so now if my hold time, my rest time, I'm going to make them short just so that we can go through the process a little bit more quickly, but
Sure.
realizing that that would be determined by the pathology and what you're trying to treat, okay?
Okay.
Then I turn it back to progressive intermittent, and then I'd hit start. So you're going to feel a pull and then a relax, all right?
Okay.
If you have any pain, you need to let us know, okay? It's not going to be strong at first. Okay. So this is going to, we're only doing 3 steps, so it should be about 25 pounds each.
How's it feeling, Russ? Don't really feel anything yet?
Okay. So it's gone about, this will be the last
Went up
pull.
about 3/4.
Right. After the last pull, when it's at the full poundage that you've set it at, that's when you open up, and the rest part, that's when you open up the table. So after this next pull, which will be at 75 pounds, you'll go up and you'll open up the table. And you can see that he's adjusting accordingly. Okay, so now it's in the rest. What you're going to do is walk over here. And there's a little lever. We'll wait until it's down to close to 0.
And is it the lever control both sides at one time?
Yep.
Okay.
You can use either side. Just push it up, okay? So now the table's open. Now in this pull, he'll probably feel more because there's less friction.
Right, yeah, 'cause I like it's sliding on the table.
You can see the table opening up.
Yep.
You don't want it to be like a huge gaping hole, but yeah, that would be appropriate. If you wanted to actually increase the poundage, if you wanted to go up higher because you didn't feel like the patient was getting a strong enough pull, this would be where you would increase the poundage.
Okay.
You don't want to increase the poundage until the table is open,
Okay.
because you're not getting the true effect of the pull.
What about these straps?
You
Should
can
we be?
tighten them down.
But it's not a big deal.
Well, if he is positioned such that he's not getting a lot of slide in his upper body, which is great. Some people will get more of that. It's just that he's got a pretty good positioning. Okay?
How you feeling?
So it's now, and it's now going down, so I'm just gonna turn it off, or go ahead and hit the stop button. Go ahead, hit the, yep, hit it. Okay, all right, so I'm just gonna hit power off, so we don't have to listen to that beeping. Then what you're gonna do is you're gonna come, and the first thing that you're gonna do is close the table. All
Okay.
right? And what you have to do is basically, can you lift up
Pull
just a little
that.
bit? There you go. And lock it in. Make sure it's in. Yeah, I think it is.
Okay.
The next thing that you're gonna wanna do is take off the straps, because the patients are gonna be like, get me out of here.
Yeah, I did this when we were in class. I don't really care for it too much.
All right, and then they can slide their arms out. Okay. And then I come down here, now before I do this, I take this off. Okay, get this out of the way, get this out of the way. This is again where I use the same technique. I say bring your one knee into your chest and hold it. Okay, then I grab here, lower your knees down one at a time. We're good.
Okay. And I got that
Oh, did you?
on
Yeah,
here
that's what I'll need
for
to
the
see.
well. So, all right, great.